Welcome to The Women's Wisdom, our journey in emergency medicine podcast, a production of the Women in Emergency Medicine section of the American Academy of Emergency Medicine. Join Doctors Molly Estes and Liz Calhoun as they are joined by prominent women in emergency medicine and other special guests.
Hello, and welcome to another episode of the Women's Wisdom podcast. My name is Liz Calhoun, and I am an attending physician at Mercy Fitzgerald Hospital in Darby, Pennsylvania.
And hello, everyone. My name is Molly Estes, and I'm clinical faculty at Northwestern University in Chicago. And we are very pleased to welcome to our podcast today the one, the only, the none other, the second to none, Dr. Dara Kass. Dara, you're here.
I am here. That's actually a very Ken Milne introduction. I don't know if you've ever internalized like the level of excitement you just gave to that is like so Ken. So I'm Dara Kass. It's great to be here. I am an emergency medicine doctor in New York. We'll talk a lot about who I am and how I got here, but about almost 10 years ago, I founded an organization called FemInEM to deal with gender equity in the workplace, and I hope we talk about it a lot. But other than that, I live a portfolio life right now where I work in the ER a little bit, run FemInEM a whole lot, and try to take care of my 3 kids and husband as often as I can see them.
Which I think we're going to use as the absolute perfect starting point for this entire conversation. So self-described portfolio life. And you subtly, not so subtly, led there with the idea that how your life looks now is not how your life looked when you first got into this business of emergency medicine. So harken back to the times before. What made you decide to pursue a career in emergency medicine, and what were some of your early career goals, jobs, aspirations for yourself? We'll use that as our foundation piece for how things look now.
I was born to be an ER doctor, I say. My mom was an emergency medicine nurse at a hospital called Brookdale in Brooklyn, New York. I was born there. She worked in the ER probably till I was like 7 or 8. And then I looked at her and said, "When are you going to be home?" And she decided to change jobs and started working in radiology. So she says I am the reason she stopped working in the ER, which I think is kind of ironic. I knew I wanted to do emergency medicine from like day one. I was like, oh, wait. I remember I grew up in Brooklyn and we didn't really do fireworks or anything. But I remember that one July 4th, we're going outside and my mom's like, you can't go anywhere near the fireworks. If you hold it, they could blow your hands off. And I'm like, oh, where do you go when your hand gets blown off? And she's like, the ER. And I was like, that's cool. That seems like a place I'd like to go. And so that was it. And then all the stories and all the things just always fed this beast of interest I had in emergency medicine, in quick decision making and the whole thing. And then I was a waitress in college. Like I did all the same things. It turns out we all had the same story. We all had the same skills, did the same stuff. And it finds people like even on the pit, right? Why do we do this? Because we're ADD and this is the only way we can survive. And then I knew I wanted to do ER. I knew I wanted to go to Kings County. I knew that I wanted to stay there for emergency medicine. And I really thought I would just do academic emergency medicine for the rest of my life in New York City, where I started a residency. I trained residents. I was part of the fabric of a department like I was raised in. And, for a few years that worked. And then about, I would say 5 or 6 years, or maybe even 8 years into my career, thinking I would go into a medical school role and become a dean of student affairs, I all kind of pivoted and I changed. In my entire career, I think shifted.
That's definitely something that we hear a lot from people on this podcast, that all of a sudden they decide to pivot or blow up their lives, or something comes across that they never expected, a happy accident, if you will, that's made them change paths. Can you tell us a little bit what happened to you at that point in your life that transformed your career?
My mom is the reason I became a nurse, and my husband is probably the reason that I changed paths, right? So he works in finance. We live in New York. And as soon as I started having kids, we started having kids, and I started watching my career versus my peers who I had grown up with, right? So lawyers, bankers, people that were even teachers, the disconnect between the way that we were surviving, right? Whether it was maternity leave or lactation support or scheduling or any of the things that we had to deal with was so different from them. My husband is a really funny guy. He's always like, why do you tolerate this? Like, why?
Very good question. We should all be asking ourselves.
He was always like, he's like, why do all of you guys, like, you're the smartest people we know. Why do you put up with this? And I'm like, wait, why do we put up with this? Right? Like, he's like, there are so many ways to solve this. And so he and I would sit and we would talk about the solutions. Like, what would I want if things would be different? How would I change things if I could? And I realized and that there were solutions out there, but nobody was really putting them together. And I had also started realizing that I had this entrepreneurial mindset, right? This idea that if I could build it, if I could fund it, if I could facilitate it, because maybe somebody else wasn't going to, that I could make it happen. And so that coupled, I think, with the fact that I started getting frustrated in academics where I felt like I wasn't able to achieve, like in the structure of traditional university settings and academics, my personality wasn't a great fit, right? I was more disruptive, a little bit louder. I really wanted to move faster than the system would allow. I'm not very patient, which again, qualities of a decent ER doctor for the most part, right?
Horrible when you're dealing with red tape and admin.
Totally. Like I think there's that disconnect. So I started realizing that I think I needed to solve this problem in a different way. And so that is literally how FemInEM started. So I was working at that time at NYU and was working on medical student programs. And I like to build things. That's another thing. I love to build things. So I had built a medical student curriculum and I had done medical student programs for third years and for fourth years and did a lot of residency stuff. And I loved it. But it wasn't solving now the prevailing problem that I was facing, which was all these women so I had thought I was going to do the careers of women in medicine from a medical school achievements perspective. And I was going to help mentor these young women to be faculty and get into whatever careers they wanted. But now there's this disconnect with all these people that were already trained in emergency medicine who are already achieved their goals of being and attending. And now the system's pushing them out because they can't survive and have babies. They can't survive and have a promotion because somebody's judging them for some other decisions that they haven't actually made or they may not make or they may make. And so I quickly realized that my role, my best and highest use, if you will, would be to pivot to creating this organization that I literally wrote it on paper. I kept like trying to figure out names. Like, what am I going to call it? What is it going to be? You know, how are we going to do this? And I wrote women, females, emergency departments, emergency medicine, whatever. And I just put things together and I got to FemInEM. I was like, oh, FemInEM. That makes sense. That's who we are. And I showed it to somebody in the ER at NYU and I said, what do you think of this? And he's like, that's great. What are you going to do with it? And I said, I think I'm going to make it a thing.
I want to know more about the process of taking an idea, seeing a need, taking an idea, having this brainchild, and then actually causing it to come into fruition. Because FemInEM, it's like nice to say, right? Like, oh yeah, and then I created FemInEM. And for anybody who's listening to the podcast who isn't familiar with that, this is now a national organization that has had national conferences, that is a coalition of educators and professionals and just rock star powerhouse women. Talk to us more about that process to get from where it was as an idea to where it is now. What are some amazing things you learned along the way? What are some things that were hardships and stumbling blocks?
So let's start from the beginning. So when I put on paper, I said, okay, FemInEM, this is a thing. What is it? I then sat with my husband and I'm like, okay, what about this? And he's like, what is this? And I said, well, I think it's an organization where I can create a marketplace to keep women employed because it's really expensive to recruit and train new doctors. And I want to show employers that it's worth it to them to keep women in the workplace. And I'm going to do it through kind of like a public union is a bad way to describe it, but like I'm going to bring the women together and then I'm going to show the employers that look how many of us there are. Look how we work. Look at the great things we're doing. And I'm going to create a marketplace where employers could show the women physicians how excited they are to have them on board. And by that, I'm going to also create a world where men are going to start to see the opportunities of being more present parents and taking paternity leave and supporting the women physicians in their careers. Because equity and how I have always viewed it is the most marginalized is the one that either identifies the problem or even tries to start solving it, but it's often not limited to them. So a lot of the issues we were facing as women in medicine were affecting men too, but they couldn't talk about it. And they certainly didn't feel like they had a case to make for it because they knew they weren't the ones that were being forced to work at 38 weeks pregnant, hopping around the ER, like hobbling while they're, about to go into labor. So why would they complain when their wife is the one that's home pregnant and they know that they wish they could have a more flexible schedule at that point in their families, kind of peri-pregnancy, peri-delivery period. Anyway, So I sat with my husband and I said, okay, what is the financial model for this? So I think one of the lessons that I want people to understand is when you go to a portfolio life or when you build something, you have to decide, like, what is your fiscal model? Like, it's great to have an idea and it's great to want to make change in the world. And you got to understand, what is the change you're trying to make? Who is your audience? What are you trying to get them to see? And how are you going to pay for it? So in the beginning, to me, FemInEM was like a glass door model, which is a model that talks about like creating a competitive environment for employers to recruit employees. And so the model that we built, or I built, was, okay, it's going to be an LLC. It's going to be like a for-profit entity, not because it was going to be profitable per se. But it was going to be faster to launch. And we were going to do it around this website where we're going to share ideas, bring people together, dismantle a lot of the biases. And in that, I would allow advertising from employers who could then talk about how great it was to work for them if you were a woman in medicine. And that was my business model. And it worked to start. And then we added on to that, well, what are we going to do to gather? Well, we're going to do a conference. Okay, well, conferences can get expensive, but they also can generate revenue. So it quickly pivoted that a lot of the money that we had generated on advertising, we kind of folded in to the conference as sponsorship. And so our annual revenue became reflective of the conferences. So when we built these big conferences, they were what kept FemInEM fiscally alive, which was me and my time and an admin and just like the infrastructure, accountants, bookkeepers, like all the things you need to run a business, because that's what FemInEM was. And the thing about it was that required me to be always thinking about the hustle. Anyone that started a small business understands that you have got to hustle to who's my next advertiser? When is my next conference? How much am I charging? What is my bottom line so that I can pay my bills? And sometimes my bills are my time. Sometimes my bills are the bookkeeper's time, the lawyer's time, the website costs, the web designer. Like, there's a lot of bills. And that was, I think, how do you go from an idea to implementation? You have to understand, like, A, what is my message and who's my audience? What am I doing? Why am I doing this? Why is this necessary in the market? And also, even if it's necessary, is somebody going to pay me for it? How am I going to make money? Because money is important if you want to have a website and a lawyer and a designer and a graphics designer and all the things. And you can't, as much as you can do it. And that's why foam, which was kind of like, we set ourselves up to fail a little bit, right? Because foam was free, open access medical education. Like, it entirely started because we were giving it away for free. Anyway, so that was the beginning of FemInEM. It's actually not what FemInEM is now, which I think sets up the whole idea of you've got to be iterative in your process. If you're looking to do something, even if it's mission oriented, you have got to be sure that you're able to meet the moment you're in and it's going to change. And when you're too rigid about what your mission is or what your like outputs are or what your income is, that is how I think a lot of these younger organizations and smaller organizations fail.
I have a really quick follow-up question. Liz is going to lead us into the next phase of this conversation, which is, so what is FemInEM today? But as I hear you talking about this, it's really interesting to me because so I have sold my soul to a career in academia. I love academics. I love educating. I love my students I work with, my residents I work with. Like, it fills my bucket. But one of the natures of the beast of academia is that all of your time gets nickel, dimed, and dollared away from you. So even on my days that I have quote unquote off from clinical duties, then I always have academic duties. And I'm trying to picture transitioning from a academic clinical career into this business model career. And you said that it was all about the hustle. How did you balance suddenly now having all of these things to eat away into your time, and you're creating for yourself a career where you have to constantly be working on your business and your idea? It seems like that kind of work life balance, lack thereof, environment would just be fraught with disaster. So how did that transition look like?
So I think for me, some of it was accountability, right? So like, I knew how much money I wanted to make. Again, it's steps, right? So I took a pay cut to start running FemInEM more when it started taking away a lot of my time. And therefore, I had to compensate for the time that I had bought down for myself by earning money. And so I gave myself 6 months a year timelines to say, you just took a $100,000 pay cut to do this. This thing has got to pay you $100,000. If it's not paying you $100,000, then you're giving away $50,000 of your time for free. Is that what you want to do? And again, there are reasons that people will give that away for free. I could take a $100,000 pay cut and only earn back 50. But again, that has to be a choice you're making with your family. It has to be paying your bills. Like there's so many pieces.
I think you're bringing up a couple really important points that people don't typically think about when they're starting a business. Not just the financial cost and the unexpected financial cost, but the cost of your time, the cost of your mental health, the cost of the effect on your family and your own personal income, let alone the finances of a business. There's a lot that really impacts that when you're starting something up. And eventually something happens that becomes a pivot point in the business and in your life, whether or not they continue to go along the same paths, but something happens that reinforces what you need to do or how you need to change. So there was a pivot point for FemInEM.
Yeah.
Tell us about that.
So that's actually a really important lesson that I think a lot of people, now I can tell it in a more succinct way. So again, hustling constantly, trying to keep it alive. Conferences were amazing. Pandemic comes, right?
Everything ended.
We all, and the thing is that FemInEM was at its core a women in emergency medicine organization. We all had something more important to do when the pandemic hit. I had also been doing a lot of work in politics before that. And so between policy and public communications and working in the emergency department, I was like, I had no bandwidth to run an organization on the careers of women in medicine when I didn't even know how many of us were going to be alive at the end of this thing. So I was like, okay, we're going to take this down to its like minimum viable product. It's going to be a website. We're not going to really make any money. We're going to pull down all the things that cost us a lot of money, and we're just going to keep it alive for a period of time. And then I get a job in the administration. And once Biden got elected, and I could not own FemInEM. Remember, I told you it was like an education organization, right? So I had to transfer ownership. And in that, it hibernated. And there was not really a path, at least right around, like through COVID, I would say to 23, the world of emergency medicine was not ready to have another in-person conference. And our entire field shifted, right? It wasn't just that, we were all taking care of patients and COVID was crazy and the ERs were overwhelmed and the economics of all of emergency medicine changed. So whereas my business model before was, here's the competitive market for women physicians because you want them to be in your jobs, now it's like people are losing their jobs everywhere. Their salaries are getting cut because there's no more money in emergency medicine because we're working harder, we're earning less. So how can that business model doesn't work anymore. So you can't ask employers to pay for physicians like perception of safety in the workplace as women when you're not even sure they're safe in the workplace as breathing humans. Like the disconnect was just too real. And so it kind of hibernated for a couple of years. And then I left the administration in 2024. And FemInEM was still hibernating, and I didn't leave to relaunch it because I wasn't even working in the ER. And I'm like, I am the wrong person to run FemInEM now. I'm not working in the ER for 3 years. I've already had my kids, and I don't even know what we're saying anymore. Like, what are we doing? And what was crazy was I think a lot of people were disappointed because they needed FemInEM, but I wasn't the right person to run it at that time because I didn't know what I was doing it for. And I didn't know what I wanted to accomplish. And I didn't know how to keep it alive. And nobody else was able to step up and say, okay, I'll run it. I know what it needs to do. And I can afford the time to do it. There's a lot of pieces to the ability to do it. So it stayed hibernated through 24. And then in end of 2024, beginning of 2025, something shifted. So obviously everybody knows that the Dobbs decision came out in 2022. What we noticed between 22 and 24 was how important emergency departments became to access to reproductive health care. And even when I was in the administration, I realized that nobody was paying attention to what was happening in ERs. Nobody ever does. Look at our boarding crisis. Like, God knows we can't. Thank God for the pit, right? Because now finally people see what we see. I cried at every episode because I was like, maybe they'll take us seriously now.
I literally had some of my students this morning ask me about it. They're like, hey, do you watch The Pit? I'm like, about halfway through because I have to stop every episode and
Right.
have a mental breakdown. But I told them, I'm like, I feel seen as an ER doctor.
Totally.
I haven't reached the end. I know about the details, but I feel seen. This is great.
I recommend it to anyone I know who doesn't really get my job, who's not in medicine, to say, this is why I'm not present for events. This is why my days off aren't days off. This is why I'm stressed when I get home. This is what we're dealing with. Having an outlet for that voice is important, but having a voice as a female physician is equally important.
The pit starts coming out and people are talking about it, but even things like miscarriage in the ER, like there's so many things about that show everywhere that like spelled out what we were doing. And from a policy perspective, right? I think about things like how we can compelling policy change. I think it's probably the most important thing that's happened on TV to help people see what we do and what's important. And so I was doing some consulting in reproductive healthcare and trying to find the places that I could be helpful connecting the ground game of ER with what was happening on a national crisis level, like women dying in our parking lots. And I hate to break it to the world, but it's very bad for our brand as exceptional doctors when the stories that are coming out are that people are in our ER waiting room, bathrooms, miscarrying, or they're in the parking lot, or they're in our department and they're not getting the care that we know how to provide because we're confused. And I really just couldn't handle that. So I decided with a couple other friends to talk about, like, as I'm thinking out loud, we were going to relaunch FemInEM as a nonprofit. And the reason was the business model. Again, there were all these people that wanted to support reproductive health care through their foundations. And they couldn't or wouldn't give money to a for-profit entity, and they shouldn't. But if I could have FemInEM, who had the same mission and vision, now be a nonprofit, I could take in donations that were aligned with what we're doing, which wasn't just now the careers of women in medicine. Although, by the way, most female patients in ERs, if they're doctors, we have an aligned purpose, but also help make sure that everybody in our field was taking better care of the females in ERs. Like, so now FemInEM kind of took a different tilt, right? And really get to the ground, mobilizing an army of ER doctors to say, what the hell are we doing here? How is it that we're confused about miscarriage management? Let's talk about ectopic pregnancy. Let's talk about, EMTALA, and let's be the ones who are at the forefront of these conversations, even in scary times and in scary places. Let's do that together. That felt so important to me now. And back to the conference and to the gathering and to the workplace and to the employment, like all the things we felt we were founded to do originally now had like new and invigorated purpose. But also with the funding that we're getting to do the work, we have an organization that can also amplify lactation policies, support workplace policies, get the message out that hiring and recruiting women physicians is good for your business and good for your patients. Like, we can exist again, which helps all the folks that it helped the first time within another mission that felt even more urgent. And that's where we are right now, is we are a fully supported 501c3 nonprofit that works on the care of women having emergencies, specifically now reproductive health care emergencies. We will evolve into, I think, more things over time. And for me, and this is back to the portfolio life, back all of it, right? I work in the ER. That's bucket A. It pays me a salary now, which is bucket B. But most importantly, I'm doing the same thing I was doing before, right? I'm teaching. I am supporting other women physicians. We get grant funding to buy down the time of other women doctors so that they can go to their employers and say, I'll take a 30% pay cut, or I'll take out 2 shifts a week and I will go and do this work. You don't have to find me funding. So it's a new way to do academics. And so in that way, it's awesome. And it's keeping me alive, I think, because God knows it's a frustrating time.
I love how you describe the different buckets of your life, right? Because I have more and more frequently over recent years come back around to that very apt analogy. And the thing that we are told since we were, if you're lucky, since you were a medical student, certainly since you were a resident, certainly since you were early in your career, about having to have something that feeds into your bucket is so vitally essential to not only our careers. It's certainly not unique to medicine, but just being able to feel like you have made a difference in life and that you're able to put some good out into the world, and that what you spent so many years and time and effort studying and perfecting actually has relevance and worth to the people around you. And in your pursuit of those buckets, I find it so fascinating that you were able to take the pure essence of this idea, completely and totally recraft it. It's so easy to say, like, oh yeah, we're now a not-for-profit business model. Literally opposite ends of the business spectrum. I don't know much about business. I know that much. How in the world have you managed to educate yourself around different business policies, around this pivot from a for-profit idea, hibernating idea, now not for profit, in order to ensure that your brainchild, your baby, this thing that so many of us need in order to continue on in what we love to do, still flies?
A lot of it is talking to people, advisors, and taking their advice, right? Hiring good people that are around us to do the good things. And honestly, I do so much of it myself the first time, right? It's like learning how to do your own EKG. Emergency medicine is such a good life lesson in everything we do. I also want to say I love being an ER doctor. And I don't love the ER doctor that I am anymore. I want to be really clear. I have a real issue with the doctor that I am versus the doctor that I want to be. I almost would go back to residency now if I could to do it all over again because I feel like I have let go. Rob Orman said something on I don't know, a video on a reel that just came to my Twitter feed the other day or whatever, some Instagram. And he has to work 6 shifts a month to be a good ER doctor. Like, what's his number of how I haven't worked 6 shifts a month in like 5 years. I've worked less than that. That has taken a hit on my capacity to be the ER doctor that I want to be. I'm still working back there. I think I'm going to get there soon. The reason I say that is I love who we are. I love our community. I'm so proud to be an emergency medicine doctor. And what we do is remarkable. So it kills me that in the real world, people see us as not stepping up in this space. And I am taking it on as my mission to show the world that we give a shit, that we will not let go of these patients because it's hard. Like we have always done the hard work. We have always shown up when nobody else was. We've always figured it out. Like we figure it out. That's what we do. And so in this case, even though I am not the ER doctor that I want to be on clinical shift because I don't work enough, and I, again, think I'm going to get there soon enough because I had to go work in the government to understand how to do the EKGs of the government, right? I went into the government to understand where does the funding come from? Where do the policies get written? How do we change a system we don't understand? I did the same thing with the nonprofit, which is to say that I spent a lot of time calling a lot of people who I knew did their own nonprofits. What is the sustainability model? I just hired a consultant who's my nonprofit coach, mine meaning FemInEM, to teach us a 3-year model to have sustainability. Because the other thing about the FemInEM version 1 versus version 2 is this version 2, my hustle cannot be the thing that keeps it alive. That was the promise I made to myself when I started. Because I know how many people are like Molly's like, me, I need FemInEM. I know how many people needed FemInEM to be alive when I could not keep it alive by both policy and by time. I will not have that happen again. So this version will be alive for as long as it's necessary. It may change, right? So if reproductive health care gets solved because another president comes in who cares about the lives of Americans and doesn't create a world where 50 states have 50 rules and women are easier or safer than they are now, then we might go back to just competitive workplaces. And that's okay too. But I think that for me, it's hiring people, or I say hiring, it's including people in my life who can give me hard advice about what we need to do and then listening to them. But a lot of it is just, I am in the guts of everything we do for the first time so that I know when we need to hand it off or build it up, what that needs to be.
So we've talked a little bit about your work buckets, with FemInEM, with your personal work, building your portfolio. But let's talk about the last bucket that we all need to have to really fill our personal bucket. Let's pivot again and tell us about you, what you like to do, what brings you joy outside of the workplace.
I would say that for the most part, my children bring me joy. And I say that because parenting is really hard, but I love them and I think they're so funny. My husband brings me like my family, right? All those things. I have a beach house. I know that sounds like a crazy thing, but I love going there because I need the air, the sun, the peace, I love being in the city, but being out of the city, like in a way that feels like very whatever. This is going to sound ridiculous. I started playing a lot more mahjong. Now, I don't know if any of you play mahjong.
What?
Yes.
Like with actual tiles or on
Yes.
Like
So-
with the grandmas, like
Yes. Okay. This is the whole thing, right? So my mom plays, my family plays, everyone plays. And I was the last to come to this because I'm always so busy, whatever. But the reason I say that is I cannot doom scroll. I cannot think about, and I will say I work every single day, like on FemInEM. Like I do something, I take my computer out, I sit in my bed and I do work I find comfort in clearing my head, and sometimes that means doing work, which I think is a hard thing for some people to understand. There are people that like shut their computer off on Friday at 5 and open it at 9 a.m. on Monday. That's how people were in the government. And when I had my government job, that's what I did because it didn't give me joy. FemInEM, the work gives me joy. If I'm laying in my bed thinking about what we're building, I consider that relaxing. But the reason I bring up Mahjong is this summer at the beach, everyone I know wants to learn Mahjong. So I plan on playing a lot of Mahjong all summer. And it's totally different than what we do. And it has nothing to do with medicine. And it is whatever. So that right now, that brings me joy. And so my family, my kids, my, Mahjong, I would say that. And just like air and space, that brings me joy too, like peace.
I just want to sit in that moment for a hot second. Peace brings me joy. And I feel like that is such a statement on what so many of us are pursuing every single day, regardless of where you are in your training, regardless of what career you have. Peace brings me joy. And we are all in the pursuit of the quietness that we define as peace, whatever that might look for you individually. Like you said, FemInEM brings you joy. That brings you peace. Doing work on that is a way to refill your bucket for you. I can't say that running a not-for-profit organization would bring me joy personally, but I have no idea. Who knows what the next 5 years of my career are going to bring? But I think that it is so absolutely essential that we each figure out, how do we find peace and how do we find the joy within that peace? How do we let ourselves settle long enough in order to enjoy that peace that we have carved out for ourselves?
I will say the thing I love to build things. It's kind of funny. My husband laughs because I build them and walk away, and I don't shut them down. I give them away. I love to build things, and I love to renovate houses. That's another thing I love to do. And so that's where I am with FemInEM right now. It's like I'm building it again to be this thing, but I'm doing it a little different intention. And I love to see the product of what I've built. Especially, I'm an extrovert. I don't like to do things by myself. So building this thing that is supporting the women in our field, the women patients we serve, but also all these other women in our field that are working on FemInEM, and they're starting to buy down their time and they're starting to see the returns on their investment. That brings me so much joy. It's like being a residency director and watching your residents grow up and fly away.
Little babies fly away.
Mm-hmm.
So let's use that as our last question then. You enjoy building things. So picture for me, if you will, you're on the beach in front of your beach house, which, by the way, we're going to have a totally different side conversation about why neither of us have been invited to your beach house just yet. So on the beach in front of your beach house, you're sitting there with your laptop open, FemInEM just on a blank page in front of you. What does the next 3 to 5 years look like? What are you building? What do you dream in your heart of hearts that this is going to be down the road?
So FemInEM is a nonprofit that supports the time of the women working on it. So one of my biggest dreams for FemInEM is that our funding allows us to allow women physicians doing this work to get paid for their time. Okay, that is one of my central mandates for this organization. We tend to give things away for free, especially when they are things that fill our buckets. My goal is to make sure that the grant funding that I have pays the time of the women working on this or the physicians working on it. So that's one. I want to make sure that FemInEM has an infrastructure that does not rely on me. So I will always be a strategic advisor to the organization and to decide what we're doing. But I want the operations and the execution to live separate from me so that if something happens to me, I know that it will live. I can't be the only thing that's keeping it historical memory alive or whatever. And then I also think that, so for FemInEM, I think that's basically it, right? Whether it has a conference, again, I don't know. Whether it has more website, more policies, whether it's creating, I don't know what products are going to be. The moment will tell me that. And I hope starting in 4 years, we are in a world where we can start advising another government on the implementation of new policies to build back some of the stuff that we're losing right now. I want to be able to say that we've been putting our finger in the dam on these things, right? This is how we've implemented this in emergency departments in Texas. This is what we've done in Georgia. This is what we've done in New York. And now I want to wrap them back into the new rebuild of the federal government that is stronger than it was before. Like, I have hope that the experiences we're generating through FemInEM now, we can advise this. My hope is for a rebuild. And so that's what I hope to be doing, I think, in 5 years, is to advise whatever the rebuild looks like. because we got to rebuild it.
I think you saying that is the hope that we all need right now, that there are brighter times in the future. And I know we're all working towards the same goal, but it's wonderful to hear such a loud voice as yours say, this is what we're doing. We are the future. These are our next steps, and we're going to rebuild this foundation.
We are not giving up just yet.
So on a message of joy, peace, and hope, Dara, it's been really, really fantastic having you on. Thank you so much for taking time out of your schedule to fill our buckets by joining us for this conversation.
It was great to be here.
Again, we're really grateful. Thank you for all of your time. Check out the FemInEM website to hear more about all the wonderful work.
And in September, register for the conference in Chicago. So we are helping to organize the Women in Medicine Summit Conference, September 18th through the 20th. The first day, the 18th, is actually a day entirely curated by us at FemInEM on reproductive health and women's health care. And it will be the most important day of education you will have if you care at all about what's happening around the country for women's health care. It's going to be unlike anything you've ever seen and unlike anything any other conference is going to have. There's a link on our website. You can see it, but please try to be there. I'm getting everyone in Chicago. Pennsylvania is not that far away, Liz, so I'll see you there. It's going to be great. And it's going to be very similar to what we had before in the FemInEM conferences. It's not our conference, but we're going to leave our mark.
On that note, we will see you all in Chicago in September, and we'll catch you on the next episode of the Women's Wisdom Podcast.
We hope you have enjoyed this podcast from the American Academy of Emergency Medicine. AAEM is a nonprofit professional association of over 8,000 emergency physicians dedicated to board certification and democratic group practice. For more information about AAEM, visit our website at www.aaem.org.